And here's where the true difference between a nurse practitioner and a physician assistant lies. It's in the... Welcome back to Health and Wellness. I'm Will, nurse practitioner, and today we're going to be looking at the differences between a nurse practitioner and a physician assistant. Now, if you want to know the difference between a nurse practitioner and a doctor, I did a completely different video on that, so be sure to check that out in the link below. But in this video, I want to walk you through and compare the differences between an NP and a PA in terms of their education and training, their job role, their collaboration differences, as well as their salary. So stay tuned. Clear! So both nurse practitioners and physician assistants are considered advanced practice providers, or APPs. So first, let's look at their undergraduate education. A PA will obtain their bachelor degree in whatever they want, so long as they complete the prerequisites for PA school. A nurse practitioner, on the other hand, has to complete a bachelor's of science in nursing. Both of these will take about 4 years to complete, but there are some accelerated programs specifically for PAs, which can help them complete this portion of their education in as little as 3 years. During this part of their education, PAs won't be required to complete any formal clinical hours, but they will be required to complete between 1,000 and 4,000 hours of direct patient healthcare experience in order to get into their PA program. This is usually experience being an EMT, a paramedic, a patient care tech, a CNA, a medical scribe, all of the above. At the same time, nurse practitioners will be required to complete between 800 and 1,000 hours of formal clinical in the hospital learning to be a bedside nurse. Once they reach graduation, PAs should have already applied to and been admitted to a PA program, and they'll move directly into that. Whereas nurse practitioners will have to pass their NCLEX RN board certification exam to become a registered nurse. Almost all of them will immediately begin working as a registered nurse at the bedside. There are some RNs that go right into their NP program without any experience, but this is not the norm. Now we're going to jump into the specific master's programs of both a PA and an NP. PAs will complete a master's degree in physician assistant studies, health science, or medical science. NPs, on the other hand, will complete a master's of science in nursing. While all PAs are trained as generalists, NPs have to pick a specific program for a specific patient population. Most PA programs will take about 2 full-time years of study, or 24 months. The first year, they'll go through didactic material covering in-depth medical sciences. Think of this like the first 2 years of med school crammed into 1 year. Then the last half of the program will be clinical rotations in pediatrics, OBGYN, family practice, emergency medicine, and general surgery, totaling about 2,000 hours of formal clinical experience. Nurse practitioner programs are structured differently, and most have full-time, part-time, and even online options. The first 2 to 3 semesters of an NP program usually don't have any clinicals, but you'll be solely learning didactic information. Then you'll start your clinicals, but at the same time, you'll also still be learning didactic information, so you do both at the same time. And where you do your clinicals is going to depend on your specific specialty. By the end of their program, nurse practitioners will complete on average about 600 to 800 hours of formal clinical experience. Once they graduate, in order to be certified, PAs have to pass the PANCE, the Physician Assistant National Certifying Examination, and NPs will have to pass their board certification as well, either through the ANCC or the AANP. Both PAs and NPs will then be able to apply for state licensure and then be able to practice as an advanced practice provider once they're credentialed. When looking at the job role differences, there really isn't any. Both PAs and NPs obtain health histories, perform physical assessments, order and interpret diagnostics, prescribe treatments such as medications and therapies, perform minor bedside procedures, and consult appropriate specialists. They both work in almost every specialty, including primary care, specialty offices, inpatient hospitalists or in the ICU, within the emergency department, home health, surgery, etc. The only real difference with surgery is that PAs more often help with the actual surgery, so they'll be scrubbing in. NPs can become a first assist in the surgeries and scrub in, but that's much less common. More likely, if an NP works for a surgical service, they'll be doing the admissions and discharges for them. And now let's talk about physician collaboration and supervision. Both NPs and PAs will work in close collaboration with physicians, but this is where the main difference lies between the two. Nurse practitioners have full practice authority in 23 states and counting. This gives them the legal authority to practice all of the aspects of their job role under their specific license under the board Board of Nursing. This means that there is no required supervision or collaboration with a physician. But just because an NP might live in an FPA state, that doesn't mean that they're not going to be consulting or collaborating with physicians appropriately when needed. It just gives them the legal authority not to have a required collaborating physician. So if they don't live in an FPA state, they will have to have a collaborative agreement with a physician. It usually involves occasional chart reviews, and the NP has to have some type of access to the physician if they have any questions. This is usually through secure text messages or phone calls, and this doesn't require an on-site physician. PAs, on the other hand, are required to work under the direction and supervision of a physician or a group of physicians. However, state-level laws will influence the degree of supervision that is required. So what does all this mean? This doesn't mean that the physician is looking over their shoulder, looking at every single thing they're doing. Usually it just involves a PA talking with their supervising physician about a complicated case, or maybe management of a specific disease process, co-signatures of prescriptions, as well as the physician signing off on their charts. But this is going to look different in every state, and in most states, the physician doesn't even need to be present at the specific location. So as a general rule, the NP route will offer more autonomy than the PA route. This specifically comes in handy if you plan on opening your own practice one day, especially if you live in an FPA state. But both PAs and NPs are great careers and an important part of the healthcare team, and both are very competent to take care of their patients within their specific scope of practices. And now let's talk about the salary differences between an NP and a PA. So in general, facilities are going to pay the same for a PA or an NP because they're both doing the same work. When looking at national data, NPs make on average $117,000 a year, whereas PAs make $107,000 a year. But remember that this is national data. The fact that some NPs have more autonomy to open up their own practice and increase their revenue, and so the national data will be skewed upwards. But in general, from what I've seen and what I believe to be the standard, hospitals, facilities, practices are going to pay PAs and NPs pretty much the same. Now, if you want to know how much I make as an NP, I made a video on that. And if you want to know the differences between an NP and a physician, check out that video as well. Thank you guys so much for watching. Now get out there and save some lives.